Hi guys. Hi Shannon. Hi guys. I'm just gonna wait a couple minutes and let people join. This is my first live, so we're gonna see how this all goes. I'm really excited. Hi Lexi. Hi Dr. Hella Harvey. Hi Matt. Hi Jana. So thank you so much for getting on my live today. I'm going to talk a little bit about what I do and who it can help, and tips on how to find an artist in your area if you or anyone you know might be interested in services such as this. So I specialize in restorative tattooing of the breast. Restorative in the sense that it gives back something that was taken away, typically by unfortunate circumstances, such as either a surgery related to cancer or maybe a complication from another type of breast surgery. So in any scenario, it really needs to be the very last, hi Jamie, it really needs to be the very last step in the breast reconstruction process. So you shouldn't have any immediate planned revisions or any surgeries or anything planned after the tattoo. You want the tattoo to be the final step that you're having. So medical tattooing for the breast can help a variety of different clients. Typically for breast reconstruction patients after a mastectomy, many times they will lose the nipple areola complex. So tattooing can help restore a natural appearance for the breast. You're using tattooing as an avenue to replace that appearance that they lost. It can be done either with a nipple reconstruction surgery or without on a flat surface. It can also be used with nipple sparing mastectomies when the nipple, the native areola has been attempted to be preserved, but sometimes after surgery, it doesn't always come through on the other side exactly how it started out. So it may have some scar tissue or be void of color. Thank you, Dr. Halla Harvey. I think you're amazing too. And after other breast procedures, such as a breast reduction or a mastopexy surgery or top surgery, where pigment has been lost in the areola, or maybe the nipples have been done as a free nipple graft, so essentially they're removed and then grafted back on, or even if they haven't, and the pedicle to the nipple has been interrupted, many times there's loss of color and then there's some surrounding scar tissue that implanting color with the tattooing process can really help the appearance with. Also, another scenario that I have worked on myself has been ladies affected by vitiligo. So that's kind of controversial when it comes to tattooing because the color, the melanin has been lost out of their skin. So if that's the case, I confine my tattooing to only the nipple areola complex. I don't tattoo out the surrounding areas. I just, because it can trigger it. So I confine it to the nipple areola, but it can also help with color restoration there. And lastly, purely as a cosmetic choice. So maybe your areolas are very light in color and you just preferentially want them to be darker, or you want to do something fun and do a shape like a heart. So that's another population of people that may reach out and be interested in restorative tattooing. Specific to breast reconstruction, and you guys let me know if you have any questions, okay? I'll try to read and answer them as we go. Specific to breast reconstruction, after your surgeon has rebuilt your breast, like I said before, it's just really to complete that whole appearance. So if you choose to have the nipple reconstruction surgery, the tattoo is done around the nipple reconstruction and then up onto the nipple reconstruction. If you don't want to have additional surgery, put an additional scar on the breast, then we do just the 3D on flat skin. It's performed with principles of light and shadow. So essentially we're doing a portrait tattoo, but it's not of a face. It's a portrait of a nipple on the breast. The artist is going to use her technique and skill to really create visually that you're going to see a nipple, but in actuality, your skin will still be flat. So if your nipple reconstruction has flattened afterwards, like many times it does, or you just choose not to have that at all, it's a great option to create that illusion of a nipple being on your breast. No matter what the case is, I use body art tattoo equipment and high quality ink to ensure that you get a result that's going to be long lasting. And many artists do as well. If you are a breast reconstruction patient, you may remember during your consultation with your plastic surgeon that their goal with plastic surgery, reconstructive surgery, is to make you appear normal in your clothing and in your bathing suit. So as a plastic surgery nurse, I've heard this hundreds of times throughout the year, and that is their goal. They want to make sure that you have symmetrical appearing breasts in your clothing, so when you are out and about in society, nobody is going to look at you any differently than, you know, they don't know that you've had this surgery done. If you're at the park or, you know, playing, you can be active and not worry about a prosthetic or anything like that. They're really creating with your body new breast for you. So that's their goal. So then if you think about tattooing, the goal of your tattoo artist is to make you feel good about yourself and to look good without your clothing on. So that's a really big responsibility of your artist. You know, they want to make sure that when you get out of the shower and you have that glimpse in the mirror, that it's not that constant reminder of everything that you've been through. It's something to make you not only feel good about yourself on the outside, but really on the inside as well. So the tattoo artist is part of the team of your breast reconstruction. So starting with your breast surgeon and your plastic reconstructive surgeon, the tattoo artist really is, they do that finishing touch. It's that grand finale for you. And also it can help detract your eye from asymmetries and kind of pull your eye into a new focal point on the breast. So it serves so many purposes. You know, sorry, I'm nervous. So like I said, it's a big responsibility for the artist, and that's why it's very important that you choose the right one. So how do you do that? I tend to tell people, really try to do an interview process with your artist. I know a lot of tattooers schedule online, and that's great, and it works good for them. I personally don't. Hi, Jill. I like to talk to my client before booking and during the booking process. So there's an interview kind of back and forth between the two of us. I either do a phone consultation with the client sending me photographs so we can talk that way. Or during COVID, I started doing Zoom consultations, which have been great. Or as always, I do in-person consultations. That way we can kind of determine if you are ready to have the step of the tattooing. Because again, if many times you're not looking critically at yourself in the mirror until you come to meet your artist and you start talking about placement on the breast and kind of helping out with asymmetry and balance and pulling that eye, then you can really take a very hard look at yourself that you may not have done before and decide, gosh, maybe I do need that revision surgery that my doctor mentioned to me, but I didn't want to have it. Maybe I should get that done before I get my tattoos placed, because revision surgeries afterwards can kind of move and shift shapes around. So it's always good to have these open conversations with your artist before you go in and have your appointment to actually do the tattoo. So when you're choosing your artist, I tell people it's very important to look at your photos, right? Healed photos. That's the most important thing, because it is impossible to tell anything at all from a fresh, red, immediately post-tattoo picture. You just can't tell. You can't tell details. And a lot of times that's what you'll be shown, especially in the physician's office. I worked as a nurse in a physician's office for a very long time, and I did a form of tattooing there. That's all the pictures that we had, because quite frankly, we just didn't take pictures for follow-up. and they didn't look all that wonderful. So the only pictures that we had were the fresh ones. So if that's all you can see, I would tell you to keep looking for an artist that can show you healed pictures. I like to show my gallery of photos to clients. I think it's great visually too, because when you're going to come in for your appointment, if you can have photos, it can help verbalize with a photo that you might not be able to do orally with, with speech, what your goals are. So if you have a preoperative photo, that is a good thing to bring in. If you find photos on your artist gallery or just on the internet that you can bring in, that's a good way to kind of communicate what your goals are about how you would like your tattoo to look. But when you're finding the artist, you want to see their healed photos so you can see what their, how their talent ends up in the final step. Every artist has a different style too, so make sure that you like the style that artist does. Also, when you are speaking with your tattoo artist, find out about their equipment, their ink. Do they, their training, their experience level? Do they use semi-permanent makeup ink that fades away? Ask them how many touch-ups that you will require. Hi, Greer. How many touch-ups you require. So if they say, yeah, you're going to have to come back every year or so and get a touch-up, no, I would advise you to not go that route. You want somebody that's going to use high quality tattoo ink that's going to be very long lasting, to make sure that you're not having to go back and have repeated touch-ups that causes trauma to the area. Your skin is very fragile there, so you want to avoid that. Semi-permanent makeup ink is good for eyebrows and such, because as it fades, it allows you to go with different styles, but you don't want, nipples don't go out of style. They, you want that tattoo to go on and you want it to stay. Also, how many tattoos have they done? What's their experience level? You really want to take the time to interview whoever's going to do this tattoo for you. Ask to speak to past clients. Also, you can read reviews on people's websites. That's very helpful as well. But really ask if they've been doing this for quite some time, they should have some past clients that are more than willing to share their experiences with people. And, that is very, very helpful, because you're getting to talk to a live human being and she can tell you how she felt with that particular artist. So that's very important. And then lastly, who does your physician recommend? They may have somebody in the office that does this procedure. So I would ask this person exactly these questions, that I've presented to you today. They need to have the same interview done, whether they work for your physician or if they're an independent artist, it's all the same. If they have, for instance, I was a nurse. I worked in a plastic reconstruction office for a very long time. I did nurse tattoos for almost a decade. Nurses are great people. They're wonderful. They're empathetic. They love humanity, but they may not be able to draw a stick figure, and that is not who you want doing your tattoo. So if your physician only offers a medical tattoo that is not really decorative, realistic. It's not a realistic looking tattoo that's done by a professional artist that's been trained, then they should have somebody in the community that they refer out to as well, for ladies who are looking for, a long-lasting quality result of a tattoo. If they don't, then I would get online. Make sure that if you Google restorative tattooing, areola restorative tattooing, you can find there are artists who are certified, and they may not be necessarily in your community, but they are well worth the drive, because you are putting something very important on your body, and you want to make sure that you get the right artist for it. So, take the time. This is the one time in your breast reconstructive process that you may have 100% control over all of these areas, which before maybe you didn't. You didn't have control over whether or not you needed radiation or whether or not you needed to have chemotherapy. These are things that, unfortunately you had to do for life-saving treatments. But this part of the game, this stage of the game, you have control over it. So you can choose who's right for you. The choice is definitely yours. So you don't have to settle for the tattoos that are offered in your physician's office. You don't have to settle for a cookie cutter nipple tattoo that looks the same on every single patient and every single picture. You have the right to take the time and have all of your questions answered in verbiage and that you understand. And that's why I really wanted to do this live and then other lives, is to educate the patient and try to take some of the scariness away from making this big choice. That there's me and there's many other artists just like me out there that take this very seriously. This work is a privilege. We hold it very sacred in our hearts, and we want to make sure that you only get the best result. And you'll be able to tell. So that's kind of the last most important thing. I tell people, ask all these other questions, but make sure that whoever you choose to do your tattoo for you has this work in their heart. Because that's probably the most important thing, I will say, in all the process about choosing. So what kind of questions do you guys have? I see there's a couple tattooers on here. There's Jody. Hi, Jody. I don't know if you would have any questions for me, but I'll open it up and let you guys tell me what you think and see what you've got. And if nobody has any questions, that's fine too. I'm so glad that you guys joined me. I was super nervous this morning when I started, so I thank all of you. I know Cooper's on here too. I talked to Cooper yesterday. All right, well guys, thank you so much. I appreciate everybody tuning in and listening, and hopefully, what I talked about today was helpful. And if you know of anybody that might have questions about tattooing, then I also did a blog on my nipplefairy.net page. So all of this content will be there for people to refer to afterwards. And then I'll embed this video. Oh, is ART certification a US-based certification? No, it's not. Actually, now they have, there's a gal named Lucy Thompson. Hi, Greer. There is a gal named Lucy Thompson over in the UK, and she's kind of the areola restorative tattoo ambassador over there. And she's a lovely human. I met her in Texas. She came over to, I did my ART training with her. And I love her. She's such a good human. She's developed a Nipple Innovation Project charity. Their system over there, the UK, they have like the, I think it's the NHS. And art is in the UK and Canada as well. Yes, absolutely. It's great. And there are, I'm just here to offer support, satisfied customer. It was life-changing. Oh, yay. I love that. I love that. Thank you. But no, Greer, that's a great question. So they are spreading all over. This is kind of, an undertaking from tattooers that have experience. So like Stacey Ray and Jody and, Terry Lively down in Texas also teaches. Shira down in Texas teaches. There are so many women who want to make sure that the tattooers doing this service for ladies are educated and that they're only doing good. I'm looking for info for my UK-based patients. Yes, absolutely. They are over there, 100%. I can send you the link, Greer, for sure. But that's very important because, if you have a tattoo that on your breast reconstruction, it can be not just physically damaging, it can be psychologically damaging for ladies because you get your hopes up. There's so many things that you just really are looking for with having your tattoo, and then if it comes out dissatisfying, it can be so damaging. And so these ladies, these great tattooers, are taking not only the responsibility of doing the tattoo like I talked about, but they have a bigger responsibility because they are training artists to also carry that forward in their own practice and make sure that no harm is done. You only want to do good for these ladies. So yeah, it's in Canada, it's in the UK too, and here. So that's great. Any other questions? Anybody? Awesome. Okay, guys, well, I'll go ahead and sign off, but thank you again, and I love all you guys. This was a great experience today, so I really appreciate all your support, and hopefully I answered questions great for you, Greer. If you have any questions too for me, just send me a text message and I can send you those links. So thank you so much. There is an artist page on the website. Yes, for ART tattooers, is that, that's what you're referring to? Yes. If you go to the Areola Restorative Tattoo website, Stacey Ray has a link to all her certified artists and which country that they're located in. And it's a good resource for people to have as well. So yes, thank you. Thank you for that. All right, guys, I appreciate you. We'll see you next time. Thank you.